Hello, this is Dr. Funda Goldman. I'm a licensed naturopathic physician, and today I was going to go through the 6 guiding principles of naturopathic medicine. So, some of you may be wondering, what exactly is different about naturopathic physicians and what guides them in their practice. And so part of that involves our philosophy. So I'm going to get in 6 principles of that philosophy. And you might even be asking, what is a naturopathic physician? A lot of people don't know. So we are considered experts in helping patients by using natural therapies. And if you want more information about what we are and how we're trained and kind of a little bit of the history of that, I would look at my other video that's titled What is a Naturopathic Physician Anyway, and How Do We Treat Acne? Because I get into that, and then I get into an example of how we treat acne versus conventional methods. So it gives you a more concrete understanding of how we go about looking at disease and patients and working with them. So that may be interesting to you. But the 6 principles that guide our practice, I'm just going to go through them quickly here and then go through examples of how it shows up as our practice. So the 6 principles for naturopathic medicine are to 1, do no harm; 2, that nature has the power to heal; 3, that we focus on identifying and treating the root cause of disease; number 4 is that the doctor is a teacher; number 5 is that we treat the whole person; and number 6 is that prevention is the best cure. So let's get into each one of those a little bit. So do no harm. This may seem obvious, but basically, when somebody shows up in front of us, we don't want to make matters worse. And if there are, for example, a few different therapies to choose from, we always want to choose the one that's going to be the most effective while producing the least amount of harm. And luckily with most natural medicines, it's not true of all natural medicines. Sometimes people think, oh, if it's natural medicine or natural therapy, then, there's no harm in it. But there are some natural therapies that can cause harm. I've seen that. Actually, I have people coming to my office who have been to different kinds of practitioners, and sometimes what I'm doing is just kind of correcting what other practitioners have done. Or sometimes people, nowadays, a lot of people self-prescribed off the internet, and they also, end up kind of harming themselves, really. Like one example that comes to mind was a young child. He was about 7, I think he was in 1st grade, and he had bloody stool, and he had been having this problem for a year, and he'd been to a gastroenterologist, and they even did like a colonoscopy and all this sort of thing. Gave him medicine, nothing really worked, and so when I have patients come in, I always ask them, like, what are you taking, both conventional medicines as well as any supplements? And so this kid was on a few supplements for allergies, because I guess he used to get really bad allergies and have a lot of mucus and congestion. But the thing is, a lot of even natural allergy medicine, they usually put in there like warming herbs or heating herbs or drying herbs to kind of dry up and melt the mucus, basically, is the thought behind it. But the supplements he was taking were so drying and so heating. Like one of them had horseradish in it, so this kid was taking like horseradish every day. So it cleared up his sinuses, but then it basically created problems for his GI system. And so basically all I did was take him off the supplements that, were self-prescribed off the internet, and he got better in a week. So, and this is a problem he was dealing with, for over a year, and he was even having, it was starting to affect his self-esteem and confidence, because he was never sure if he was going to be able to make it to the bathroom like at school, and he might embarrass himself. So, kind of a simple case, but, an example of do no harm. So the second principle is nature has the power to heal, and that's part of why we use the therapies we use. I mean, food, so nutrition. I do nutrition therapy with almost everybody who walks in the door. Flowers, herbs, plants. I do a lot of herbal medicine. Water, so whether it's internal hydration or external hydrotherapy. I do a lot. I actually used to teach hydrotherapy for a few years to medical students. And even things like sunlight, getting out, getting fresh air, exercising, movement, all these sorts of things, energy therapies. So that's part of the reason why the therapeutics we choose to use are there. But the other thing that's kind of even deeper than that is that, at the kind of foundation of our philosophy is that we respect nature, and we aim to understand nature, like nature in general, but also the nature of the person in front of us, and harmonize with her, nature in general, instead of trying to control her. So, this is even like, eating things like suggesting people to eat seasonally or have a seasonal routine or something like that, just to kind of understand that, as nature changes, we can modify ourselves to be in harmony with her instead of being opposed to her. And this is a little bit different than the conventional model or modern model, where some medications are really about kind of trying to contain the situation and trying to contain or control chemical processes in the body. And yes, we do have herbs and therapies to, for example, stop inflammation in naturopathic medicine. But we're also looking at people as part of nature instead of like, it's an us versus them type of mentality. So when somebody comes to my office, I think I have a little bit more of a mindset of like a gardener rather than a mechanic. Yes, you can definitely get into kind of a biomechanical, biochemical mode with naturopathic medicine. And there, even within naturopathic medicine practitioners, there's a spectrum. But when people show up at my door, I'm thinking like, okay, is this person, their internal environment, mentally and physically, like, or even emotionally, are they more like a desert? Are they kind of hot and dry? Or are they more like a swamp where they're hot and wet? And so that's kind of what's in my mind is I'm choosing different therapies, because if their system is hot and dry, then I want to come in there and cool it down and provide hydration, right? But if they're swampy, I want to cool them down and dry them up. So, again, it just gets into our mentality bit. And again, there is a spectrum for naturopaths, so keep that in mind as well. So the third principle is to identify and treat the root cause. So this gets into the idea of, rather than treating symptoms, because symptoms, well, they tend to be a little bit superficial, even though the symptoms are what are, problematic for patients. We feel that like if we can get to the root cause, it's like pulling up, instead of just whacking weeds in your garden, it's about if you actually go down and pull them up by the root, then they're less likely to take hold and multiply and create a bigger problem in your yard. So it's the same thing with people. If you can identify the root cause of what's causing the symptoms for people, you're more likely to create a more beneficial situation for patients and keep them out of trouble. So this also gets at the idea that like if you have 100 people who are complaining about a headache, you may actually, each person may have a different root cause for why they have the headache in the first place. So one person might be they have a headache because they're sitting at their desk and they don't have good biomechanics, and it's putting pressure on the back of their neck. So it creates what's called a question mark headache, where it usually starts in the back of the head, the occiput, and then the pain kind of starts to radiate on top of the head and can go into the forehead and behind the eyes. And that's because of basically posture and positioning, right? But you could have another person who has, like I had a patient who, she was getting migraines that were worse during her period, but she only started getting migraines. She worked in a lab, a medical lab, and she only started getting migraines after there was some sort of chemical spill, and I think she got like phenol on her, some other chemical on her, and she had to basically strip down and wash herself off like right away because it was so caustic. And so anyway, when I did a cleanse with her, mostly a liver cleanse, but a whole body cleanse, and we got some of that stuff out of her, she stopped getting migraines. So there you go, just two examples of how headache, root cause can be very different. And the idea of this is that it also, takes into account individuality, right? Because everybody who shows up with a headache may have very different reasons based on their individual lifestyle, individual habits, individual diet, a lot of things. So, it's not like one size fits all. So the fourth principle is doctor as teacher. And so, again, we're taught and we believe that the primary function of a doctor is to teach. And part of that gets at, if we can teach some, it's sort of like, do you give somebody a fish or do you teach them how to fish? So if you teach somebody how to take care of themselves, then they can get better if they're already sick, or they can stay well if they're healthy. And so you get into this whole prevention, like it's just easier all around for the doctor and the patient and everybody if you keep people healthy and focus on that and teach people how to stay healthy rather than them show up in the office when they have a problem and you fix them, but you don't teach them how to stay healthy, and then they just kind of keep coming back with the same problem. So how does this show up like in my practice in a more concrete way? So when I see patients, I typically spend an hour with the patient. In the first half, I'm getting information from the patient, questioning them and doing a physical exam, for example, or going through their blood work or radiology reports or what have you, to really get at, diagnosing, the root cause. Look back at the previous slide. And then the second half of that hour, I'm teaching the patient how to take care of themselves. So I spend a lot of time teaching people how to change their diet and how to eat. I even give people recipes sometimes. I demonstrate how to do like different sort of stretching, yoga postures, breathing exercises to reduce stress or help with their body or alignment. So I do a lot of teaching, and that's even why I created this YouTube channel, is because I wanted to teach and help people get healthy or stay healthy. And so this also gets into the idea that it's much better to prevent disease than to, again, dig somebody out of a ditch if possible. So we spend a lot of time teaching. The fifth principle is to treat the whole person. So even if somebody shows up at my door and they're complaining about something very physical, like maybe they have a knee problem or something like that, I'm always thinking about their health on all levels: physical, mental, emotional, spiritual. So what does that mean? It's like, one, when I meet somebody and I'm thinking about okay, so what was it about this person, their lifestyle, their attitudes about life or themselves, their body or whatever, that they ended up with a knee problem to begin with, right? So I get a sense of their personality and motivations and priorities and that sort of thing. And then it also helps me choose different therapies or create a comprehensive treatment plan for this particular individual. So, for example, if I know somebody, if they come in complaining about knee pain, but I can see and we start talking about, they also have anxiety, I might choose herbs or a plan or something, or even nutrition that's going to help them with their knee pain as well as their anxiety, not just, one-shot deal for their knee. So, I'm always kind of thinking when I develop, again, choose therapies and develop a comprehensive treatment plan, understanding the person physically, mentally, emotionally, spiritually, it's much better, I think, way and more effective way to help somebody develop a plan that's going to be reasonable and sustainable for this particular patient. So that's the thing is, what that means is that, again, there's no sort of cookie cutter model here. It's not going to be one size fits all. I have a set protocol I give to everybody who walks in the door for knee pain. I really have to go through the details of somebody's life to understand what's going to work best for them. And the sixth principle here is prevention is the best cure. And when I first started thinking about this, the only thing that came to mind was yes. Maybe it's obvious to everybody. But, again, this gets at why we spend so much time teaching people and engaging people in healthy lifestyle choices. Because, again, we can keep people healthy. that's really the best, right? So people can just go live their lives and they don't have to keep coming to the office. I mean, I'm happy to help people. I mean, don't get me wrong. I mean, I'm happy that I can help them, but you know, my goal actually is to get somebody better so they can just go live their life and not have to worry too much about like their health. They can, you know, keep that in balance with as part of, you know, their whole life. Yeah. So yeah, it's also, there's a little kind of interesting tidbit here. So we used to talk about in naturopathic school, you know, back in the day in ancient China, the way that physicians were paid is basically a family would hire a physician, and they would pay the physician monthly. But the role, the concept of the role for the physician in that time and place was that the physician's role was to prevent disease. So they were working with the family every month to, like, you know, work with their diet and, you know, check in with them and see how things are going so they didn't get sick. If somebody did get sick in the family, though, they would stop paying the doctor because it meant that the doctor was not doing their job of keeping the family healthy. So you can just imagine this is a very different even payment model and incentive model, really, for, and even indication of like what conceptually is the role of a physician. So, which in a way is actually kind of a conflict of interest based on the way most physicians are paid today. Yeah, so anyway, that's always kind of an interesting story that you know, people are interested to hear, so I thought I'd toss that in. So there you have it, a bit short and sweet today, but again, I think understanding the principles, understanding, you know, our foundational philosophical trainees, naturopathic physicians, is helpful to understand why we do what we do and how we do it. Again, it plays out in different aspects for when people show up to the office. So anyway, I hope you found this helpful and interesting and educational, and I thank you for your time. Until the next one, take care.